In this episode, I welcome my former student who now obtained DNP Doctor of Nursing Practice degree, Dr. An Yang. She's gonna talk about how she prepared for life and career after graduation and what helped her to prepare. She got accepted to one of the prestigious nurse practitioner residency program in the United States, and she's gonna share her experience of being selected for a resident. This episode will be especially helpful for those who are thinking of becoming a nurse practitioner in the United States, or you're a nurse practitioner student and want to start thinking about life after graduation. So sit back and relax and enjoy our conversation. Aloha, I'm Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. Thank you so much, Anne, and soon to be Dr. Anne Yang, for joining this episode. Today, she's going to share with us about how it was to be a DNP student and how she prepared for graduation, which is coming this Wednesday, and then her plan as a new grad nurse practitioner. So I'm very excited to talk to you today.
Yeah, thank you so much for having me. I'm so excited.
Me too. So
Yes.
let's get to the juicy part. So
Yes.
tell me about your career history. Were you a nurse before going to DNP program, or actually you are a GEPN student? So share us about that.
Yeah, okay. So I didn't do the traditional nursing route. So prior to nursing, I was working in biotech, and then COVID happened, and then lockdown happened where basically I had nothing else to do except to reflect on my life choices. And so from there, I realized that I really wanted to help people directly and hands-on. And for me, I've always admired nurses because I always thought that they spend the most face-to-face interaction with patients. And then I've also had some exposure to nurse practitioners a few times with minor illnesses. And I really respected them too, because actually, the nurse practitioner was the first provider that sat me down and she actually drew me a whole picture of the menstrual cycle when I was asking
Mm,
her about birth control. And so as a
mm,
20-something-year-old, that was actually really helpful because I didn't know anything. And so from that,
mm,
I was thinking like, I think nurse practitioner or nursing in general would be a really cool field. And then when I saw that the deadline for the NP school for UH didn't pass yet during COVID,
mm.
I was like, okay, let me just apply and see what happens. And so I applied, got in, and yeah, I couldn't be happier. I'm so excited that I made the switch. And I feel like in general, nursing school was hard, but I do feel like this profession has made me a better person as well. So
That's awesome.
so that was my journey. So biotech, and then I transitioned into GEPN, which was a fast track into nursing. So you get your RN within 1 year, and then from there you are expected to continue on with the graduate school, and that's another 3 years for the DNP degree.
Anne did a preceptorship at my clinic, and then I was honored to teach her during her
Yes.
women's health rotation.
Yes.
And I happened to encounter a lot of excellent GAPN students. So you mentioned the first year you learn how to become a registered nurse.
Mhm.
So I can imagine we spent 4 years to get bachelor degree. It's condensed to 1 year. So how was it? Is it hard? How did you survive that?
Oh my gosh, it was really hard. How I survived was basically having a support system. So, as Dr. Miura knows, she took on two of us. It was me and my classmate Teresa. Teresa and I, we did GEPN together. And then luckily we have another friend too. But I would say the support system was the number one thing of getting through because it's just rough. It's 7 days a week. You don't get a break, you get no holidays, and it's for a whole year. So, it's 3 semesters. But like you said, 4 years is crammed into one. But yeah, how did I get through? Just pure will and just leaning on my support system. I think that is what really carried me because I think mentally it's so exhausting. So to have that extra support and just friends rooting for you who's also going through it with you as well, it just helps you get to the finish line. Yeah.
Yeah, absolutely. And I feel the same way when I was a nurse practitioner student. I'm lucky to have wonderful
No,
nurse practitioner friends, classmates, but that was before online education became more common. I think nowadays it's a little harder for students
that's
to
true.
connect with
Mhm.
peers. What did you guys do? Like, how do you connect? Because it's hybrid, right? It's
It's hybrid.
online.
Yeah.
Yeah. What did you guys
Yeah.
do?
Yeah, that's a good question, actually. I think naturally our personalities were just similar and we got really lucky that we found each other. But what we did was, I think how we got close actually was during Sim Lab. Just coincidentally, me and Teresa, we happened to be in the same group. So typically in Sim Lab, they split you up into six. I don't know if all nursing school is like that. And then you go into it together. And I think just naturally we gravitated to each other. So if you can find that, I think that's really important. And then from there, we found that, oh, we really like food and boba. And farmers markets. In between studying, we would text each other, oh, would you want to grab boba really quick before a study session or something? And then I think just trauma bonding too, just that brought us
For
closer
sure.
as well. Yeah. So I think
Definitely.
that's how you connected. Trying to find something else besides school that you can meet each other in the middle.
And it was so cute to watch you guys helping each other. And
Yeah.
that's why I like precepting as a group because I'm
Yeah.
hoping to give some opportunity even for students from different schools
Yeah.
to get through the same hard experience as a DNP or NP student together.
Yes.
So I think it's wonderful that you had the resource, and then I'm still close to many classmates from nurse practitioner school.
It's amazing.
Yeah,
Yeah.
so I think it's going to be a lifelong friendship, and I'm so glad that you have that.
I know, same. But yeah, thank you so much for taking on both of us. I think also as a DMP student, it's so nerve-wracking when it's you and the preceptor alone because you want to do well. So it's kind of nice that I had a partner because then it kind of takes the tension off a little bit. So I really appreciate that. So thank you very much, Dr. Miura.
Of course. And
Yeah.
then I do have to say, my preceptorship is probably not the easiest,
No.
just because I personally, as a new grad, struggle because I did most of the rotation with physicians and then shadow them most of the time. So I was just observing then what they do.
Mm-hmm.
But after I graduate, I started to wonder, so what can I do as a nurse practitioner? And then I
Mm-hmm.
also, shadowing is just, you think that you're learning to some extent, but doing it with responsibility on your own is just totally next level. Oh,
I completely agree. Yeah. So yeah, we loved your rotation. To this day, I think you taught us the most and
oh,
it was really, yeah, no, I really appreciate everything. You went into detail. I'm so grateful. Yeah, I feel bad for all the classmates that didn't have you. No, I'm just kidding.
I
Yeah.
think that's why I'm trying to help with the online platform because I
Yeah.
can't teach, I can't
Everyone.
precept everyone, but I'm
Yeah.
hoping. So we're gonna get into that in a minute. So you mentioned about how you decide to become a nurse practitioner, and I can picture you becoming excellent nurse practitioner. You're about to graduate this Wednesday. I'm so happy for you. You worked so hard. It's super
Yes.
hard to become a nurse practitioner, but you decided to get into fellowship program, and then
Yes.
I'm very proud that you get into one of the top fellowship program in the United States. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. So, first of all, when did you start thinking about your life or career after graduation?
Yeah. Okay. So the honest truth was what really actually helped me was the MP Career Starter Kit. So I know that I'm not just saying that as a plug because you introduced it. I genuinely mean that because prior to that, I was talking to some upperclassmen, asking them for advice, but it was all fragmented and they gave
Mhm,
great advice, but it's just all pieces. And then I even
mhm,
talked to the dean about a year and a half ago, asking her for advice, but it's very general. So I
mhm.
want to say thank you for sharing that with me because it literally
Of
came at a
course.
perfect time. It was like a godsend. Like, if I have to be honest, because it was at a time that, yeah, I'm about to graduate. I was a year out and I was like, okay, so what's next? What's going to happen next? And then this NP career starter kit fell into my lap and I watched every video. I really liked how the first section was about taking your boards, which is very important. The second
Mhm,
session was about helping you find a job, which I think is everyone's new grad's goal is to get a job at the end. And I loved how you took it a step further too, which is the third section, which was like after you get your job, what to expect on your first day. So I'm not there yet, but I was like, okay, this is amazing. This is awesome. I love how it's all in one place. I love how detailed it is. And then I would say in the second section, when you were talking about finding a job, the video that really resonated with me was when you mentioned the fellowship and the residency, because everything you mentioned there, I was like, this is me. This is exactly what I want. I wanted more training. I do want to feel more confident, and I wanted to go into a program that was designed to train me, people who actually
mhm,
wanted to teach me versus like
mhm,
going for a job and just hoping that maybe my coworkers are nice enough or they have the time and
mhm,
resources to answer all my questions that I don't burden them. Or I
mhm,
had a lead nurse practitioner who also had the time to
mhm,
just take the extra steps to train me because I think it takes a lot of effort on their part. When you kind of mentioned about the residency and the fellowships offering that extra layer of support and also extra time, I was like, oh my gosh, this is exactly what I wanted. So that's what, long story short, so after going through those videos, it really helped give me a clear guideline and also validated how I was feeling to finally make a decision. I think what I'm going to do next is I'm going to apply for residency and just kind of see what comes along and hope that I
mhm,
can get that because I would much more prefer to get a residency where I can kind of hone my skills a little bit more. And then that way,
mhm.
when I finish that, I would feel like, okay, I think I know I can do this now. But because right now I feel a little bit, oh, kind of scary. So, yeah, long story short, that's kind of what
Yeah.
motivated me to apply for residency. Yeah.
And I think everybody feels unprepared, but more so
Yeah.
if nurse practitioner program is so short. If you're in
Yeah.
master's program, it's 2 years, DNP
Yes.
3 years, but you have to work on the project. So,
Yes.
and then you have to catch up with the tasks and then exams and stuff like that. So
Mm-hmm.
you don't really think ahead of after graduation.
Hmm.
But from my experience talking to students like yourself, I realized things hasn't changed as much since I graduated. So basically the
Yeah.
school, I mean,
Yeah.
they do their best, but
Yes.
school teach you how to, I guess, pass, not exactly pass the board even, but how to finish courses.
Yes.
But
The
then
foundations. Yeah.
exactly. But you don't really get any support for how to pass the exam or
Mm-hmm.
even how to choose the exam, which is best for you. And then
Mm-hmm.
when to start looking for job,
Mm-hmm.
what to do with negotiation, and then
Mm-hmm.
what to choose, which job to take, or as a new grad, what to expect and how to cope with the stress and so on. So I feel like there's a huge gap between graduation then to become a competent nurse practitioner. So I'm glad that you enjoyed it.
I did.
Yeah, I made
Yeah.
that program based on my own experience, but also luckily, talking to students that I come across, they gave me so many insight, like this is what's needed and stuff like
Yeah.
that. I highly recommend to start thinking about after graduation. Like you said,
Yes.
I started thinking about it a year before
Mm-hmm.
graduation. And I think that's super important, especially nowadays. There are a lot of nurse practitioner programs, and that means a lot of graduates. So, though,
Yes.
yeah,
Yeah.
nurse practitioner job is best job in the United States and stuff like that. But it can be very competitive to
Yeah.
find good jobs. I'm glad that it was very helpful. I hope you are enjoying this episode. Before we go back, I want to mention about our new course, MP Career Starter Kit. I created this program based on my own experience. When I was a nurse practitioner student, I did most of the clinical training under physicians. So when I graduate from the program, I didn't know what nurse practitioners can do, what I can do as a nurse practitioner. Also, I didn't learn about when I should start studying for certification exam, which certification board should I choose and what to consider, and how to study for the exams. I also didn't learn in school how to prepare for a nurse practitioner career, like how to look for a job, how to prepare my resume, how to prepare for job interviews, and where to look for jobs. Also, I didn't learn in school how to survive the first year as a nurse practitioner, which was extremely difficult. Even though I graduated as valedictorian and had good grades in school, I still felt very unprepared to work as a competent nurse practitioner, and the pressure was very intense. And that was many years ago, but through working with nurse practitioner students, I realized that things hasn't changed much. Nurse practitioner students are not taught in school how to prepare for their nurse practitioner career. So I developed Nurse Practitioner Career Starter Kit to give resources for nurse practitioner students and career starter nurse practitioners the skills that they can use to start amazing nurse practitioner career. This program consists with 3 sections. The first section focus on certification exam. The second section focus on how to get your first nurse practitioner job, from how to write resume, how to prepare for interview, whether you should consider getting into residency program or fellowship program, and so on. And the third part is about how to survive and thrive as a new grad nurse practitioner. And as bonus, you get to watch an interview with my dear friend and ex-classmate and nurse practitioner colleague. We talked about how to negotiate employment terms, including salary and wages. And the other special bonus content is about coding. A lot of jobs require nurse practitioners to code themselves, and the coding may directly affect your income. And in fact, for my main job, the coding directly affect my productivity bonus. And a lot of times you don't learn coding in school, so this is definitely necessary skill as new grad nurse practitioner. And this course is online and on demand, so whenever you need any parts that you need, you can watch and rewatch, so you can learn the skills that you really need right at that moment. To learn more about this program and reviews by students who actually took this course, you can go to the website janpproject.mykajabi.com/MP Career Starter Kit. Again, janpproject.mykajabi.com/MP Career Starter Kit. And you can learn about this amazing program so you can have wonderful and exciting nurse practitioner career. Now let's get back to the episode. Now, so there's pros and cons, as I mentioned during the course of going to getting a regular job as a nurse practitioner versus going to residency program and then fellowship program. How did you make that decision, and then why did you choose that particular program?
Yeah, that's a good question. So yeah, I made the decision because what I mentioned before, I just wanted that extra time and support to just continue my learning. Like what you mentioned too, how you said that like during NP school, like yes, I think the school does its absolute best in preparing us, but every clinical is so short every semester. So right when I feel like, okay, I understand their flow, like the provider's flow or my preceptor's flow and like what they're doing, the semester ends and it's okay,
Yes.
switch gears. So I thought that doing a residency versus getting like an actual NP job would be perfect because it's designed to help you and for a longer period. So my program is about 12 months, I believe. And why I chose this program in particular was because when I went to the info session, I really liked how the first 3 months I only see 4 patients. So it's kind of nice. So they ease you into it. And then on top of that, I
Mhm.
have somebody on top of me, so a mentor who's gonna
Mhm.
double check everything, which is what I really ultimately want because I personally don't feel comfortable prescribing something and I just don't want to do any patient harm. I just want to do the best job. So I like that I have this extra like check that can check my work and make sure it's all correct. That can also read my notes, make sure that like I'm writing it correctly. Because like I think you've mentioned this before, but once you are on your own, it's kind of awkward to tell your colleague, hey, you're not doing something right. But at least in this like student mentor environment, I can take these not criticism, but critique, and it's going to be
Mm-hmm.
very helpful. And then
Mm-hmm.
so after that, the next semester, I think they raise it to 8. So they slowly, the goal is to get you to see, I think 20 to 22 patients, which is what I guess a full-fledged NP on their day-to-day. So it's very gradual. So that was something nice. I'm not just getting thrown in. I have so I can
Mm-hmm.
double check my work. And then it's 4 days of clinic. And then the fifth day is didactic slash catching up on your notes. So I thought that
Mm-hmm.
was really helpful too, because I think a lot of maybe other NPs or even NP students, writing the note takes a long time and it's an art and it takes a
Mm-hmm.
while to organize your thoughts and get really fast at it. Something that I knew during school was that I was extremely slow. I would take an hour and a half writing one note sometimes. And if you're seeing 22 patients, that's not
Yeah.
efficient.
Right.
Yeah, so I really liked how this program didn't, not only did they not throw you into seeing patients, but they also gave you an extra day to just catch up on your notes and organize your
Mm-hmm.
thoughts. And so that carries on actually, I think, all four
Mm-hmm.
semesters technically or 4 quarters. But yeah, so that's why I chose this program and ultimately why I chose an NP residency over a job, because I feel like a
Mm-hmm.
job, depending on it's very like a variety, you don't really know if they're going to throw you in or
Mm-hmm.
if they'll give you 6 months to train. That's something you ask for during an interview, but it's also on their end too, like what they need. If they need
Mm-hmm.
somebody right away, then they may
Mm-hmm.
not take the extra time to train you. They might be like, okay, three
Right.
months and then done. But you don't really
Mm-hmm.
know until you get the interview. But at least for this, it was
Exactly.
like all set. Everything is set before I started. So I just like that extra support.
So
Yeah.
the downside of, I think there's so many benefit of fellowship.
Yes.
But the
Yeah.
one of the downside is less pay, I believe. It's
Yes, it
like
is. Yeah.
on average, like 70% of, I don't know the exact average, but my
Yeah.
impression is about 70% of what regular nurse practitioner would make. But at
Yeah.
the same time, after you graduate, you're going to be more marketable. Especially,
Yeah.
are you going to work with a specialist, maybe endocrinologist or
Mhm.
dermatologist or something like that?
Yeah, I think we do. So this residency is actually in primary care, but I
Mm-hmm.
do believe that I probably will, maybe there's some cross interdisciplinary because you have to
Mm-hmm.
you work with other specialties and also get their recommendations and advice. So I think there is that aspect. But for this one, I purposely chose primary care because I wanted to go into primary care. I thought it was a good umbrella that could eventually lead to something more specialized. But yeah, I do think that there will be some exposure and maybe, fingers crossed, maybe it could even lead to a job potentially, building those connections.
Yeah. But even if you can't get, I think, yeah, not all residency program, fellowship program guarantee you that you can stay at the
Yeah.
same health system and get a
Yes.
job, but you're going
Yes.
to be absolutely more marketable after showing that I completed this really, first of all, to get in is hard. How many
Oh,
people are chosen to be a part of the fellowship per year? Do you
yeah,
know?
so this fellowship only accepted 10. There's only 10 because they only have 10 clinic sites, which I think is actually a good number.
Mm-hmm.
I think one of my classmates, he got in a residency in Washington and they only accepted 5.
Nice. Mm.
Yeah, so it depends, but this one has 10 because there's 10 different clinic sites. And then I believe 50 people applied because I saw 50 when I was signing up for the
Wow.
interviews, there's 50 slots. So I'm assuming that
Wow.
was like 50 people that applied, but I'm not 100%. That one they didn't say how many people applied versus yeah. But that one it was
Yeah.
very set. 10 usually 10 seats
Wow.
open. Yeah.
For those of you who don't know much about residency program, fellowship program, unfortunately, the slots available for residency fellowship program for nurse practitioners are much smaller compared to the number of nurse practitioner graduates. So
Mm,
only handful of people can get into these fellowship and residency programs. But if you can get in, I think there's a lot of benefit. I think another benefit is you have opportunity to meet people, different providers in the system. So when you become a provider, you know who to refer to because they'll be like, Anne, I know her. She's great. If she's asking for something, I know that's important. Like the other day, one of my patient who had like heavy vaginal bleeding from fibroids, and then she really need to get surgery done right away. But the office said, oh, the next available is 1 month later. But I used to work with the surgeon. So I called him up and say, I don't use this card all the time because I don't want to bother him all the time. But
Yeah.
he knew how I am. And then also he knew that when I call, this is a
It's
special,
serious.
serious. Explain to him what's going on, and he's, I'll see her in 3 days, and then
Wow.
he's immediately scheduled for surgery. So
Wow.
I think it's really nice to know people, not just by name, but they know you, and you have a
Yes.
special relationship. So if anything happens, you need a favor to ask, then it's much easier. So I think the networking is another huge benefit comes with the residency and fellowship
Hmm.
program too.
Yeah, and I also just want to say that's like an attest to you and your work ethic and how competent you are that a surgeon's okay, a month? Okay, just kidding. 3 days just like for you. But I think that really shows. So I just want to stress to any students, if you can get Dr. Miura during your rotation, yeah, you would be very lucky and you would learn a lot.
But you have to study a lot.
Yes, that too. Yes, you have to. Yeah, I think it was every week we had to prepare a short little presentation, but it's
Yeah.
all worth it in the
Hmm.
end.
Yeah,
Yeah.
you just everything we have to learn. It's not because from common sense or I saw
No.
somebody doing it, so I'm gonna do it too. Everything is based on evidence. So you mentioned a little bit about the process of being selected for fellowship program.
Mhm.
So you apply online and then you got some interviews.
Oh yeah, so the whole process is pretty long. It was longer than I expected. So yeah, you
Mhm.
apply, and then this one was pretty good. They'll tell you when your recommendators like send in. They're pretty good at keeping you in the loop. So they'll be like, "Oh, so and so submitted their letters of rec for you or completed it." And then maybe 3 weeks go by, and then they'll say, "Oh, congratulations, you got accepted for an interview." Or maybe they'll say, I don't know, maybe they'll say, "Oh, sorry, we can't go further with your
Mhm.
application process." And then once the interview comes out, then then you sign up. And so that's when I saw that there was 50 slots open. And then from there, you do your interview. This interview was actually the most different interview that I've ever done. So how they phrase it was, this is what some like med school residencies do their interview, but they basically give you 3 scenarios. You only have 8 minutes to answer each scenario. And then in each scenario, you're not allowed to make small talk. So I thought that was very interesting. Yeah, I never had that before. The purpose of that was because they said that everything that they know about my personality was based just on my application, my essay,
Mhm.
my letters of rec, and my ultimately my resume. So they said everything that we could ask you, we already can see it on paper. So this is just to test your clinical knowledge as well as like
Mhm.
to see how you think in the moment. So it's pretty
Mhm.
nerve-wracking. So there's like you go into the interview, you get into a breakout room, and then they give you the first scenario. They give you 2 minutes to think about it, and you have to show your piece of paper as well as your pen because they were like, oh, we don't want you looking on AI, but you're allowed to write notes. So you get 2 minutes to kind of think about it, gather your thoughts, write up a plan, and then from there you have 6 minutes to present. And then once those 6 minutes are up, they'll say, okay, thank you for your time, even if you're like mid-sentence. Yeah.
Wow.
Yeah. So that was really different. So they gave three. So one was an ethics question, one was an actual
Mm.
clinical question, and then the third one was like a time management question. So it was
Oh.
yeah, it was really interesting. And two of the questions I did well. I didn't run out of time. So it's kind of nerve-wracking because when I finished, they were like, anything more you want to add? And I was like, no. And they're like,
Am I
okay.
supposed
Yeah,
to?
I know. Am I supposed
Yeah.
to say more? And then they put me in back in the main room, and so I had to wait for the next one. The third one, I actually did run out of time a little bit, so they were like, "Sorry, thank you so much, but we have to move on." And so I was like, "Oh, shucks." But um, but yeah, it was really different. So I don't know if other NP residencies do that, but just a tidbit to prepare you. Yeah.
It sounds like it's probably more than 50 applicants because when you sign up for the interview, then there's so maybe not everybody sign up for, was
Oh
able to
yeah,
sign up for interview. I have a feeling
maybe.
it's probably
Yeah.
there were way more applicants. But so when you answer those questions, was it not like a case presentation kind of thing or like this is
No.
how I
Yeah.
do or the
Yeah.
essay kind of style?
It was like, this is how I do. So they gave like a scenario and then they had A, B, C, D, and
Mm.
they would ask questions. I'm just trying to remember, but on the ethics question, they'll be like, oh, what would you do? What is the safest practice? How would you, I guess it was like a very family oriented question. Like, how would you ensure that the family stays together? So you just go through it, answering
Interesting.
it. Yeah. So it's like an
Uh-huh.
A, B, C kind of thing.
Oh.
It wasn't like a case presentation where you had to
Mhm.
like say, oh, this is a 58-year-old female, etc. But they just want to see your thought process is what yeah. And then okay, so sorry to answer your question. And then after the interview, you wait about 2 or 3 weeks. They're pretty good. They'll tell you, okay, within these dates, we'll let you know if you get it or not. And then once you get it, then you have about a week or so to say yes or no. And then yeah, that's the whole NP residency process, at least for me.
Wow. And
Yeah.
then how did you prepare your essay and interview and resume?
Yeah. Yeah. I think I just tried to make it very relevant to me and what I wanted to do. So I was very not exactly sure what I want to do. So I was pushing myself for primary care. So when I wrote my resume, I tried to make it like, okay, so I did like I tried to encompass anything that I would think that a primary care would.
Mhm.
So I try to cater my resume for the NP residency program. My essay, I looked up the residency program. I did a little bit of research onto their mission values. There was also some information where they had previous cohorts talk about their experience. So I tried
Mhm.
to make myself look like the ideal candidate, like what they
Mhm.
had accepted in the past. I
Right.
also attended their info session and I asked them,
Mhm.
what are you looking for in your
Mhm.
NP students? So I catered my essay for that. And then preparing for the interview, I had no idea what to prepare for because they don't really tell you. They just say, oh, it's going to be three scenario based questions. You have 8 minutes to answer each scenario. There's no small talk. And so I just assumed that, okay, I think it'll be definitely a clinical question. The time
Mhm.
management and the ethics question threw me off because I didn't
Mhm.
prepare for that. I only
Right.
prepared for clinical. So what I did
Mhm.
was I kind of looked online. I tried to look up the most common chronic illnesses
Mhm.
that you would see in primary care and like how you would manage that. And that's how
Mhm.
I prepared for my interview. Yeah.
Excellent. And then
Yeah.
in the nurse practitioner career starter kit, we also go over some tips on
Yes.
resume, interview, and stuff like that too. But it also you have to cater or
Yes.
individualize to the organization you apply for. Now, did you only apply for that fellowship program or you apply for other?
Residency program. That one I didn't move forward, but I didn't get to go forward. So this is the one that was able to move forward with all of them. Yeah.
Got it. Oh,
Yes.
but I'm so excited for you and so proud to
Oh,
get
thank
into,
you.
yeah. And then eventually you're thinking of coming back to Hawaii. And
Yes,
I can't,
definitely.
yeah, I can't. We need primary care. I'm so excited and
Oh,
I
thank
can
you.
foresee, yeah, you're going to be like nurse practitioner leader in our
I
community.
know.
So very, very excited.
Thank you.
Yes. If you give any feedback to current nurse practitioner students, whether they just started their program or they are about to graduate, what advice would you give to them?
First, I would say get a rotation and follow Dr. Miura if you can. I'm just kidding. But yeah, if you can't, then find a mentor or someone you can really look up to and strive for, like a role model. So that's you for me.
Glad.
I really respect everything that you do, like how you always look for the most evidence-based guidelines for your treatment plan, how you push your students to present the data and plan, because if you can't communicate, even if you have the best plan, no one's going to understand you. And so I
Hmm.
really appreciate that and like just how you write notes and your overall flow. So I would say if you can, try to find a mentor out there that you can
Hmm.
really try to strive to be. The second one is don't compare yourself or get discouraged when a
Hmm.
door closes. I think when you're in your last semester, your classmates who are like your support team, in a way, I don't want to say competing, but in a way, in your
Hmm.
last semester, it kind of changes because now you guys are all
Hmm.
applying for kind of the same job or
Hmm.
fellowship. And so, like,
Hmm.
say your classmate gets something that you don't get, it can be very discouraging. And I just want to
Right.
say, please don't get discouraged because I truly believe when one door closes, another one will open, and what's meant to be will be. So don't take any of that personally. Maybe that just wasn't the right job, but the right job will come for you, or like the door will open. So yeah, don't compare and don't get discouraged. And then the last one is be kind to yourself because this profession is so rewarding, but it's also really rough because it's one of the few
Hmm.
professions that you have to give very customer-like service care, but
Hmm.
there are also really heavy hardships and conversations that you have to navigate. And I don't think a lot of other customer, not to put down other like customer service, but when you sell a car, it's like a happy thing. But sometimes in this
Hmm.
field, you can get bogged down by bad news. And
Right.
so just please don't forget self-care and leaning on your support system and just being kind to yourself. And you can do it. That's my advice.
Those are excellent advice, and I
Yeah.
particularly love that you mentioned about the little bit of weird shift, and I remind me that when you're about to graduate,
Yeah.
I think, luckily back in the day when I graduated, nurse practitioner weren't as common,
Okay.
so I guess there's not many jobs. But yeah,
Oh,
I
okay.
still felt a weird feeling like, oh, she got a job, and then started to feel like, oh my
I
God, I have to
know.
hurry up, or
I
like, oh,
know.
I really
Yeah.
need to yeah. So, so those are such a great advice. And then, yeah, I think even if your first job is
Hmm.
not ideal job or
Mm.
you end up with specialty that you're not that interested in.
Mm-hmm.
Like maybe, I'm not saying, let's say you end up with dermatology. First of all, maybe you may like it. Who knows?
Yeah,
Or
100%.
yeah, or maybe you work at dermatology a couple of years and then you feel very comfortable and then you look for a better other job and then you find a family practice job with higher pay because in grad you're experienced. But now
Yeah.
you can say, hey, I'm family practice with the strength in dermatology, and then your colleague's gonna be like, oh, you have alopecia, eczema, psoriasis. Send to Miki or send to because
Mhm.
she is specialized in that. Who knows what direction your journey is going to lead to, because I
Mhm.
think any experience is super helpful. Also, if you can't get into fellowship residency
Mhm.
program, maybe do what I did, which is kind of like, so back in the day, there is no residency program or fellowship program for nurse
Mm.
practitioners in Hawaii. So my first job, I asked employer, can you read every single note of mine for the
Yeah.
first whatever. And then my pay was low. Actually, when I think about it, it was even lower than nurses at a hospital. It was pretty
Oh,
low. But what
wow.
I care about is the mentorship. So she
Mhm.
read every single note. And then BGN that I got to work with read every single note until the point that she was like, can I stop? Because there's nothing to say. But
Yeah.
yeah, but definitely that gave me a confidence that I'm doing the right thing. And as
Yes.
Anne mentioned, I think once you're out of the world and then be independent, you rarely get feedback, which can be good and bad. But the bad is you might be doing something wrong. But especially if you're in a private practice that you're not working with many people, and then for large organizations like mine, we get peer chart review. So we get feedback every so often and make sure we're checking the box and make sure we're doing the right thing so that there's some opportunity to learn and get feedback. But if you're working in a private practice and nobody's watching you, even if you're doing crazy stuff or super outdated, yeah,
Yeah.
nobody's going to say anything. And then maybe you realize when you totally screw up and get sued, and then you
I
realize you've been
know.
doing the right thing. So you definitely don't want to get to that. So if you can't get into residency fellowship programs, alternatively, maybe get a job, but ensure that get a job with guaranteed mentorship. So
Yes.
even if the pay
Yes.
is low.
Yes,
Yeah.
I agree. So important. Yeah.
Yeah. Anyway, thank you so much
No,
for
thank you.
sharing your
Yeah.
experience. And I think this is so empowering for nurse practitioner students and, start
Yeah.
thinking ahead. Yes, school
Mhm.
is short, but, start thinking ahead and then also cultivate friendship with your
Yes.
colleagues. What you're going through, like I just met with Maui nurse practitioners yesterday
Wow.
to connect
Okay.
with them. And
Yes.
then we just immediately clicked because
Oh.
what we experience is it's also different from when you're a registered nurse. As a provider, you make diagnosis. What if you misdiagnose? What if
Mhm.
you prescribe wrong medication? Patient might call you after hour. Those kind of stress registered nurses may not understand. It depends on
Mhm.
what they do. So I
Mhm.
think having the peer who understands exactly what you're going through is so important. So
Yeah.
yeah, thank you for sharing that.
Oh,
And
thank you. Thank you so much for
yeah,
having me and also being my preceptor. So
of
really appreciate.
course.
Yeah,
Yeah,
really
so
love the rotation.
good luck to you, and
Thank you.
keep me posted what's
I
gonna happen to
shall.
you. Yes,
Yeah.
but appreciate you and so
Mm.
excited for you.
Thank you. Thank
Thank
you.
you.
Good luck, everybody.
I hope this episode was helpful for you. If you like this episode, please give me thumbs up and make sure to subscribe to my channel. Also, if you have any questions or requests for future episode, please write down in comment section. I'm looking forward to hear from you. All right, I'll see you in the next episode. Aloha.